Welcome to the Surgeons in 3D Printing podcast, and today I have very special guests from Barcelona. I have with me the Head of Imaging Department, Innovation, Research and Quality at Sant Joan de DéuHospital, Barcelona, Dr. Josep, and Arnau Valls, who's an engineer at the Innovation Department and a co-director at 3D Expert. Welcome.
Thank you very much. Thank you, Ruchi.
Yeah, so it's a pleasure to connect finally. We've been talking to each other for the last almost 2 years, I should say, and finally we connect today. I would like to ask you, what is your role? I mean, my listeners should know what your role is in the hospital for Dr. Josep and for Arnau. So let's start with Dr. Josep.
Well, in fact, my role is I have part-time is in the diagnostic imaging department as a head of the area, and I'm a neuroradiologist. So part of my time is dedicated to clinical assessment of imaging in neuroradiology in pediatric area. Then I have a part in the support of all the management of the department, but in radiology, but also I have a part in innovation and research area, and this is through some different projects, some national and international projects. One of these projects is Expert 3D that we will talk later, and also I'm part of the 3D department, who is led by Arnau.
Wow, amazing. So Arnau, partially it has been said, but please introduce yourself.
Thank you, Ruchi. Well, it's an absolute pleasure to be here. And from my side, I have to say that we share many projects with Josep in terms of research. So my role in the hospital is in innovation and research, leading national and international research project or European projects. But also I dedicate part of time, as Josep said, in coordinating the 3D planning and surgical planning unit of the hospital, and co-director of the postgraduate course in medical image post-processing with Josep, Expert 3D.
Right. So I know that you're doing an amazing job. I've been following that. But before that, I'd like to ask you, what was the most interesting area of 3D printing that you came across? What brought you closer to 3D printing? So Dr. Josep.
Well, for me, there is a part that I always loving is, and we are pushing to do more and more, is that the biomodels in vascular imaging. Why? It's because it's part of my ancient history as a neuroradiologist, and I always push Arnau and all the team to do the best biomodels, because just imagine in a hospital, one important area is that cardio, and you can imagine that congenital cardiopathies are amazing diseases, extremely difficult to understand in base of the 3D relation between the cavities, and this is an interesting part to study. And it's also related with another part that we are trying to push more and more, that this is the computation of biomodels and flow models, and this is an area that it's interesting. But in fact, I love the application of 3D in any plan, not just from printing, but also from virtual reality, and also for just for the classical 3D radiologist imaging, such as volume rendering or surface SSD. This is part of our last experience as a radiologist. So we deal with 3D last 20 years. So it's part of our daily routine, and that's interesting for us.
Yeah, wonderful. For Arnau, what is the interesting part for you? I'm sure it will be a little different.
Yeah, I would say that coming from a technical engineering background, seeing that the merge of knowledge from clinical side and technical side and bringing out knowledge to the table can solve real unmet needs. And for that, I think technology like 3D printing helps a lot on personalizing treatment to each patient needs, creating patient-specific tools, and giving the surgeon and everyone something in which they can practice and train with all their senses, also in the tactile, not only in a visual way. So I would say that this merge between knowledge and solving real unmet needs with such a technology.
Yeah, because
I'm sorry. If I can add something, this is very interesting. It's just some points. It's the 3D interpretation of image, and this is very interesting. It's not all the people is prepared and has experience in the interpretation of the position of the tissues. And as Arnau said, just it's extremely interesting, important. This new technology to understand the position and the relation between these images. And the second part is just adding more information, is that just remember, and you as a surgeon, you know that there is a skill and a tactile memory. And this is very important in some cases in patients that you need to prepare your hands, your brain, your motor area, to your memory. Just trying with the printed models, and these two areas are extremely important nowadays in the personalized medicine.
Yeah, definitely. It gives you a lot of preparation before you actually are in front of the patient. And as you said, for congenital cardiac anomalies, it's so complex, and it brings a lot of simplicity with respect to the models when you see them actually. Right. So how did you come together? I mean, you're an engineer, you're a doctor, and how did you where did you meet? How did you come together?
You are asking for our love story, right?
Exactly, your love story, yeah.
Okay.
Well, I had to say that from a radiologist point of view, we always have half of our brain and half of our head is part technical and part clinical.
Yes.
So it's quite easy to be in love with an engineer.
True.
Maybe the most interesting part is if I now explain the history of the department, 3D department, because in fact I'm just started 4 years ago in the hospital, but the history starts before my arrival. So maybe Arnau should explain.
Yeah. Well, I think that's a story of not only a radiologist and a technical engineer, which it is also, but also surgeons and other people experts in simulation. And we started in 2013 with the first really complex case of a neuroblastoma, an oncologic case, that a surgeon, in that case Lucas Crauel, needed more information to know the relation in the anatomy of the patient. And with that, we, together with university here, Technical University, Polytechnic University in Catalonia, developed the first patient-specific anatomical model to see the anatomy of the patient and see if that can work. And after that, the amount of cases that we had, as it was a success, start to increase and the demand start to increase. So we decided with this multidisciplinary team, with Josep, with these surgeons, Lucas Crauel, Josep Rubio, and Marta Ayats, and others, people from simulation, people from financing in the hospital, create a multidisciplinary group that can define which is the best model of implementation of a 3D planning unit in a hospital. And that's how it was born, the 3D unit, in the 2015-2016.
Right. Amazing. That's an amazing love story. Well, but then what were you doing before that? Like, were you completely into the technical background and engineering aspect?
Before that, I was doing research and innovation in digital medicine in the hospital,
right?
Applying my technical background in this area, which is
amazing. Right. So perfect. I totally love the story because it makes sense and it actually impacts all the specialities. That's something very important because holistically it is impacting a lot of patients across different specialities. Now, how did you come up with 3D Expert? Because I understand you were helping patients. And so how did you come up with the next step? Because I think coming to the academic structure of the course, and all of that part comes after you had a good amount of experience and stuff like that. So yeah, do tell about that as well.
That's a great question, we discuss a lot of why we decide to start to creating expert 3D, and that's clear. Once we start to rise the department with all the professionals that has experience, as Arnau said, the surgeons, the engineers dedicated to the planning and printing, also the economical area, radiology. We analyze, and we found that there is a lack, there is a gap of not just not really knowledge, but there is a need from a translation of languages. We needed to identify a common language for the clinical and from the engineer part and from the radiology part. Because we saw that there is a sub-optimization in some processes if we do not do that. So the idea to create the course was really to create these skills, basic skills, from different backgrounds, from radiologic imaging area, from surgical area, and from engineer, to put a tabula rasa of a base of knowledge in 3D, starting from the beginning from the process. That means understand the clinical need, the surgical need, understanding the anatomy, but not just the classical anatomy. Thinking in the radiological anatomy, in tissue, that it is the best tissue to segment, then moving from the 3D planning and printing, and then finishing in the quantification of imaging, because this is also a part, interesting part, and it's related with analysis of imaging. And that's why we decide to create the course. Just first to have our own skills, to have our own students, to prepare them to be part of our team, but also we decide to spread the course over the hospital and to share with the others.
Amazing. That's a very long journey, and I think it is going to impact a lot of people, and people really need to know, because I do understand there is a difference in the language, the way we converse when we are talking about 3D planning, and those languages and those file structures, and you need to know all of that, and then you need to have your the skill set which you need to build up with the course. Definitely. So tell us, Arnau, can you tell us more about your course?
Yeah. Well, that's a course that covers, as Josep said, a gap. We didn't found courses like that in the market, and that's why we decided to create it our own. Basically, coming from the unmet need and from a hospital, so being vendor agnostic, let's say. So focusing on the need and the process, and the skills that we found that we lacked in the team and that we needed. So it's a course that goes directly to surgeons. We have of the people coming to the course that are surgeons, a third that are radiologists or specialty in imaging, and then engineers or technical side. And we try to mix these three teams, making it a reality. It's a postgraduate course that is accredited by the University of Polytechnic of Catalonia and the Medical Academy of Catalonia also, and with 8 weeks course, international course, 8 weeks with theory online being blended, and then 1 week of practical classes. With face-to-face courses, and also now we are in pandemic, but before it was very nice because people from abroad came here and can touch, print, plan, and the practical classes are one of the main outcomes of it. So and that's something, an idea that was built by Josep, but that I think it's really nice as an image, because we try to make students the first day on Monday of practical classes, we provide a clinical case as if it was in the hospital, and on Friday they have to deliver with the multidisciplinary team the whole planning of that surgery, and they have to defend that in front of the teachers.
Wow.
And they have to not only create the planning but also cutting guides, printing models, everything. So we hope that this, and that's what we've seen, it's a very transversal course so that they can then apply all this knowledge to their daily life.
Amazing.
So some of the most amazing things that we found is that in these 3 years that the course started 3 years ago, is that we used real cases from our hospital to as exercises, and we propose from the groups of students some plannings and some proposals of printings, and you can't imagine how amazing planifications are, how amazing solutions they provide us as a new professionals and new experts. And we always wait the new amazing and new math and new funny solutions from the study, from the students. And that's for us, it's in fact, we are now in the middle of the Barcelona course.
Okay.
And so we are expecting the solutions from the students, and it's always funny and always amazing how they build up so fast the knowledge and the structure of how to plan in 3D. Yeah.
Wow. So what do you think about 3D printing in terms of cost? Because what I've heard is that 3D, this is like generally said that cost is a barrier to, implementation of the technology. So how do you perceive this? So the reason to ask you is because, somebody would do the course, and then what about the implementation? If, it comes to the machinery, it comes to the softwares. And so people kind of get a little critical about that. Yeah.
Yeah, absolutely. I think it's a really, really good question. And I think it have a cost. So in fact, when we talk about challenges of applying this new technology, one of the main challenges is the cost of technology, machinery, but also materials. And then that you don't really have a reimbursement yet in most of the countries for this kind of cases. So we are lacking the real environment, administrative, regulatory, and in terms of cost also, to have it perfectly in the point of implementation. However, there's plenty of literature that shows the improvement in times of surgery, the improvement in quality, the improvement in outcomes and results, the improvement in security. And I think at the end, if you have it well done, well protocolized, and you use it for the cases that are really needed and that brings the most value, it pays off. But I think one of the main problems, and that's something that we discussed and that we try to improve internally in our unit, happens mainly is that applying 3D printing is not just printing bone part of the patient. Maybe for that, you just with a virtual reality or a virtual image and planning it's enough. But you have to bring those things that are tools really for the surgeon that will help on the surgery.
Yeah, very true. It is a combination of, I think, all three things together: the material, the structures that you have to print, and the need of the patient, if there is really a need or not. Dr. Josep, would you like to add something to this?
Not so much, because that, as I now said, we are pushing, trying to convince the policies that this is a reality,
right?
In some kind of surgeries, not all the surgeries.
Yeah.
And as FDA and the American Society of Radiology, they are very advanced in this area. Europe, we are not so far, but we think that at least for our part in the 3D department, and now we are pushing to convince and to define really what are the real cases that we need 3D, and at least try to monitorize this, because if not, it will be difficult really to apply in the daily practice.
Yeah, that's
and
true.
This is important. I'm sorry, this is important.
Very important, yeah.
And I think that in the 3D community, this is one of the ideas that should be more discussed. The standardization and also the high value care, define it for some diseases, but apply it and try to define as a community which ones are the goals for, and try to push to the policies that for the recognition of these 3D 3D printings or plannings or guides, whatever we decide. But we need as a community to push in Europe, because remember that we had in May the NDR, and so we need to be as more clear and as more packed as a community in order to push and to decide what to do or what not to do.
Yeah, very true. This is something which is need of the hour now. So that's very true. And I think every country and every area has to, specifically every hospital, you can say, that has to push it in a common direction so that we can come to a common goal and really achieve, because this is really helping patients. But I think the challenge is not such a big challenge. That's something that cannot be done. So it's about the people who need to take those measures and help us out on that, definitely. Anything that you feel I did not ask? I'd love the conversation.
I love it. Also, I think there's many topics to tackle in this technology. Maybe I would add just future prospects that we have, if we may. So where we are going now. So we have a 3D planning unit with 200 cases a year.
Wow, that's a big number.
And a multidisciplinary team. And we are focusing in 8 specialties and growing. We are going through the final case of certification, so following the MDR standards. But where we are going in the future, and I think we have to advance in what we said, new materials, new technologies that are more patient-like, that have lower costs, and that can be applied at the point of care. And also pushing on terms of regulation. And in new applications, I will just start and leave Josep to develop on that. But one thing that we are really closely looking at is how to move planning from before surgery to online during surgery. And I think here Josep can explain a little bit more and develop on that.
Yeah, just to explain an experience that we are performing. This is a pilot study that it is part of 2 PhD from students of all hospitals and led by the maxillofacial department. This study, it's focusing in just to analyze in patients with maxillofacial surgery, so distractions, for example, or osteotomies. We during the surgery, we perform a 3D comparison and real time between the planification, not just the scan before the planification. We can do the comparison between the planification and just the CT. We have a combined CT, so we perform a study during the surgery.
Oh, okay.
So we compare the images. There is always a technician from imaging, and also it's Marta Yats, who is the engineer doing the planning, and she compares the relation. She compares the images in the STLs, and if there is a lack of difference, she just talks directly with the surgeon who is in the room, in the surgical room, and says just move 1-2 millimeters in this direction. So in one surgery they do the correction of the surgery, and that's the example that Arnau said. So we are moving the 3D or to a 3D, real-time 3D in operational room. That's for us one of our challenges.
I think that's amazing, because I think you can save a lot of time with that, and you can also bring closer, the accuracy can be even more. And so it's interesting. And especially with, I think you're talking about orthognathic surgeries, if I understood.
Yeah.
Yeah, so that's amazing. I hope all the best, and I hope we have something new, and we will await your scientific publications with so many cases. So yeah, do keep us posted. Amazing. That was an interesting conversation. Thank you for coming here and taking that time out. I would ask my listeners to actually go to the show notes area, look out for the link which will lead you to the 3D expert course. At least look out for the course and you will then understand what are the areas covered. And it's an interesting area. And we have people who are teaching it from years together with so much of experience. And thank you for sharing all of that with us.
Thank you.
Thank you
for the invitation. It was a pleasure to be here.
Thank you.
Absolute pleasure to talk. Thank you.
Thank you.